Welcome back, live from ASRM, the American Society of Reproductive Medicine in Philadelphia, Pennsylvania. I am with the fabulous, my friend and colleague, Dr. Serena Chen. She's an IVF doctor in northern New Jersey. She runs an amazing clinic, and we're here to talk about a really important topic that was just covered in the Washington Post about men and what they eat and drink and how much sleep they get and every other lifestyle factor that goes into men's reproductive wellness. So this is a common thing that's starting to creep up on the app all the time. So first, let's talk about weight first, because we're going to have sections of men's reproductive wellness that we're going to cover. Okay. Let's talk about weight first. How does weight impact a man's reproductive ability?
Well, number one, weight is inflammatory, and weight can affect general health. So we know that obesity can lead to higher rates of heart disease, cancer, diabetes, kidney function, and what people don't realize is that it can actually affect reproductive health. So we know that men that are overweight or obese, that population does have higher rates of infertility. And whether is it possible, we don't fully understand exactly all the mechanisms by which this occurs, but we know there's a strong correlation. Possibly it's because excess fat is an active organ, and one of the things it does besides makes inflammatory cells is it also makes estrogen.
Okay, we have to underscore that. Excess fat is an active organ. That's a mind-blowing statement.
Huge.
I mean, that means that when you eat food, though, that food is going to go to the active organ to support the active organ rather than to the organ that you want food to go to sometimes.
Well, the thing is, I'm definitely not familiar in deep detail with that type of science. There's a lot of really cool and interesting things going on there. I just know if you have a lot of excess fat, you tend to make more sex hormone binding globulin, and you make more estrogen. And what are those things? Sex hormone binding globulin is actually like a testosterone sponge. It's a testosterone vacuum.
Wow.
So it's actually lowering your testosterone. It's lowering your active testosterone. So you could be making
need the active testosterone to produce sizable amount of sperm. Honey, we're live, baby. To produce sizable sperm, and the entire mechanism is dependent on how much testosterone you have.
To have normal male reproductive function.
Exactly. Okay.
So if you are, so men, what I want you to know is, like, everybody's out there thinking, is my testosterone low? My energy is low. My libido might be low. Do I need to go to the doctor and get some testosterone? And maybe your doctor is like, yeah, let's get you some testosterone because it's going to help you feel better. You will feel better, but you will drop your sperm count. Okay? Testosterone is directly anti-sperm production. It signals your body to stop producing sperm. And the reason I want to talk about weight so much is that what's the number one cause for low testosterone in the United States, at least? We think it might be actually obesity and overweight. Okay, we have an obesity epidemic in both males and females, and the best way some people have true low testosterone, but the vast majority of people with low testosterone, guys with low testosterone these days, actually have it. A big part of that low testosterone picture is the excess weight. So the best way to raise your testosterone, I say, is throw away the beer and get off the couch.
Okay. Now, it's also important, though, for us to let men know that you don't have to look like Zeus. You don't have to be a power builder to restore wellness.
Right.
Because I think there's this really confusing spectrum. And you talk a lot about, like, don't focus on the number so much. Don't focus on the BMI number so much. But focus on kind of overall wellness. And I mean, one of the best things about male fertility is that you can check your progress and see if you're improving, because you can check your hormone levels, you can check your sperm analysis to see if your weight loss or increased amount of muscle, which can help balance things out, is actually improving things.
Yeah.
So can you touch very briefly on the sperm washout that happens every 3-4 months for a man.
Right. New sperm is produced about every 72 days. So you quit smoking, you eat more vegetables, you get more exercise, you get more sleep, some healthy weight loss. I don't want you focusing on numbers. I think it's better to focus on just eating healthier.
Right.
You're going to feel better. Your testosterone level will naturally go up. Sperm production may go up. It may not be the whole picture.
It might not be, right?
But it could definitely help. Certainly there's no downside to optimizing your general health, because we know there's going to be an impact on your reproductive health.
Okay, let's do some quick do's and don'ts.
Okay.
Vaping.
Vaping, no, don't vape. Please stop right now, okay? So I know what's killing you. When you smoke cigarettes, I know increased risk for heart attack, stroke, cancer, okay? But vaping, why are people dying so suddenly? We have no idea. It's a real mystery.
Scarier.
Yeah, please just stop right now. Just stop.
All right,
okay?
no vaping, no vaping. Alcohol.
Alcohol. So alcohol, I think a little bit of alcohol is not a bad thing.
What's a little bit though?
There's a large study I like to refer to, a big Lancet study, that said that they see a correlation between infertility and having more than 3 servings a week. So a serving is 1 beer, 1 glass of wine, or 1 shot of liquor. The problem with liquor and beer, a lot of carbs.
Yeah.
Okay, wine has some antioxidants, so you do have to be careful about a lot of sugar with alcohol, but in general, moderate drinking, no more than 3 servings a week is perfectly reasonable for guys. And does not seem to be associated with higher rates of infertility.
We have a lot of people coming on our app and saying, my guy drinks 6 beers a night.
Yeah, 6
so
beers
to
a
go
night
down to
seems
just
like a lot.
3 per week
Yes.
for a lot of these
Yeah,
guys.
you can't do it in one day.
Yeah,
you can't do it in one day.
Okay,
I think
that might be hard. Yeah.
Yeah, I think one step at a time.
Yeah,
and
right.
I think people need to understand. Well, there are these studies. There is some evidence. Let's try to be healthier, and maybe your guy doesn't want to give up his 6 beers, but maybe he'll go to light beer and eat more vegetables.
Right, good compromises.
Right,
yeah.
and give up the vaping. There's only so many things we can do at once, so don't beat yourself up. Do something, small steps.
Okay.
Right?
Marijuana.
Marijuana. There's a lot of evidence for both male and female exposure to marijuana that it does not set you up for a healthy pregnancy. Now, having said that, there's less data than what we have for cigarettes, but a lot of the data we're seeing is there can be a negative impact.
Is it both smoking and eating?
That's a good question. I'm not sure we've sorted that out really yet.
Okay. All right.
That's a very good question.
Take home lesson on alcohol, vaping, smoking, eating, or smoking marijuana is just listen. If your goal is to have a baby, now's the time to restore your wellness and optimize things. Just steer clear, right?
We just want you to be healthier. So we're trying to avoid chemicals, endocrine disruptors, Allison. Let's talk about endocrine disruptors.
Yeah, endocrine disruptors.
So endocrine disruptors are chemicals that are found in a lot of our plastics and a lot of our soaps and cosmetic products like cologne and lotion and soap and shampoo. And then in plastic food containers. So you could go a little crazy with this, but to make a big difference today, you can stop microwaving in plastic. We think endocrine disruptors actually can be associated long-term, possibly with cancer risk in both males and females. And we know that pregnant women have to stop exposing themselves to those things. There is a direct impact upon birth defects. So we'd really like everybody to do it, including men. And so that means no more cologne, and go fragrance-free and paraben and phthalate-free with your soaps and shampoos. And we can put in a link later,
Absolutely.
Right, to
Yeah.
EWG.org, environmentalworkinggroup.org, or some other resources like that.
Okay, my last question has to do with temperature of the testes.
Oh,
so there's a
temperature of the testes.
Yeah, and there's a great movement about don't cook your balls. Okay?
Don't cook your balls. Okay.
Let's talk about hot tubs, wearing cotton underwear, or...
So there's a lot of stuff from Dr. Google on this topic, and
we don't like Dr. Google.
It can really be confusing.
We want to fire Dr. Google.
So, and I get these questions every single day. So, don't be embarrassed if you're wondering this, because everybody asks this question.
Yeah.
But what we're looking at is core body temperature. Are you really raising the actual temperature of the testicles themselves? And there have been studies done on boxers versus briefs, and the type of underwear you wear doesn't seem to make a difference in scrotal temperature.
Great.
So I don't really worry about underwear.
Okay.
But I don't really want you sticking your balls in hot scalding water. Okay, so that means no hot tubs.
Yeah, got it.
But hot showers are different.
Because you're not just sitting in hot
exactly.
water.
The specific gravity of
Right,
air
right.
doesn't allow you to really raise your core body temperature when you're under a shower.
So you don't have to start taking cold showers all the time.
Yes.
That's great news.
Yeah.
Okay.
Yeah.
You don't have to approach it like a military boot camp.
Maybe you can go in the hot tub, but just don't stick your balls in. You can stick your legs in.
Okay,
Yes.
okay, but that's really important. And then there's been a lot of talk even within the biking community about the impact of the bike seat and how much biking you do. I mean,
it can be really tough on you.
Right, exactly.
Your whole bottom.
Yes.
And I think you do want to use protective measures, but we don't really have good evidence that tight bike shorts causes infertility.
Right.
And obviously exercise and people being really excited about exercise is in general a great thing. So I don't feel like
exercise,
exactly.
No.
I don't really want to discourage that.
Now weight though can also impact the temperature.
Yes. So
especially the weight
big obesity,
on,
like that big belly, can definitely raise testicular temperature. So that might be one of the mechanisms via which obesity impacts the sperm. But we also think, we also remember that beer belly, that is an anti-testosterone factory, essentially.
Right, so we just want to avoid that. So I think this is great. I know it's overwhelming. There's a lot of takeaway information, but really if you're struggling with being overweight or obesity, the key is to get moving, cut calories, but do it in a healthy way. I think eating vegetables could not be said enough because you don't want to be malnourished during this time. You actually want to be super nourished and get all those antioxidants that come from fruits and vegetables, right?
And the good news is guys do have a lot of testosterone on board, so they can build muscle fairly easily.
Exactly.
Which means that really some small modifications for most guys can really make a big difference in
very quickly.
Some weight loss. And there's also a ton of evidence, that like you said, you don't have to be Adonis. A 5 to 10% weight loss makes a huge difference in your insulin levels, your blood pressure, and your cholesterol. Those things we really know can be measurably lower.
So if you're 220 pounds, a 10% weight loss is only
11 pounds is 5%?
Yeah, 11 pounds is 5%, so 22, that's it.
Yes.
That's not a giant amount.
Huge numbers.
No, we're not talking about 50-pound weight loss here to have a big difference. So the takeaway message is hope. Do it together as a couple. Now is the time to abstain from the do not list. It's not do not forever. Let's just get you going in the right direction.
Let's not make it all about negativity and denial. Let's make the healthy lifestyle kind of fun.
Exactly.
Could this be a fun, try fun new foods or try fun new activities?
That's right.
Right?
Yeah, that's right.
It's
sex is a fun activity.
Yes. Exactly.
So let's get moving, right? It's good exercise. Yeah.
Exactly.
I think that the key for MedAnswers and for Fertility Answers has always been we want to help you make healthy babies.
Yes.
So let's wrap it up there. I think that is such incredible information. We will add the links below. My little one, who's my IVF miracle, I think wanted to say hi. He's relaxing at his probably 4th ASRM conference that he's gone to, and he's only 6. But we're all about healthy families, and I want to say thank you to Dr. Chen. It was awesome.
Alice. Thanks for having me.
Yeah, and you know what? We'll add all those links, and we'll see you on the Fertility Answers platform. Dr. Chen's available to answer questions on that platform. Ask all the questions that you have anonymously and privately, and you can find us on iOS and on Android. We'll see you next time. Thanks so much.
Bye.